The governor announced that restaurant workers and some for-hire drivers may soon be eligible to get the shot, but he's leaving that decision up to counties. Does Chautauqua County have plans to include those workers in the vaccination category now?
Well, we're looking, and what people need to realize is, we're looking at, restaurant workers in New York City. What people need to realize is this, I have yet to be approached by the taxi cab drivers union here in Chautauqua County or the collective bargaining unit asking for help. We don't have taxi drivers of great number, let's even say Erie County. What's concerning for my staff and our COVID-19 team, we talked about it this morning, is the governor puts this out and saying, well, it's in the hands of the local health departments. Well, you know what? The state has micromanaged everything from the beginning and had strict guidance. Why now all of a sudden is it up to the local health departments to make a decision? It's a concern for me that when things start to unravel, when things aren't going in the direction the administration likes, then we're going to give control to the local health departments. With the vaccination process, the local health department should have been there from the very beginning. Not the group that they punt to now to try to come up with a solution. So it's very frustrating, and not that we are slighting those individuals at all or those professions, but we still have people in Chautauqua County who are over the age of 65 with comorbidities. We have people that are cancer patients, people that have organ transplants, people that have other comorbidities that because they're under the age of 65 don't qualify. We need to take care of the people most vulnerable. And that's the key to this, and that's what our group is focusing on. We are not shortchanging anyone or anybody, but what we're focusing on is those are most vulnerable. If we want to keep people out of hospitals, we need to keep people that are out in the public, people that are not eligible yet, that have those comorbidities, who really could end up in the hospital because of getting COVID. That's the group we need to focus on. An Uber driver who's 35 years old, making some extra money, okay, but are we going to vaccinate a group then, and we're going to forsake people that are cancer patients? They don't meet the qualifications now, or organ transplant patients that don't meet the qualifications. I mean, we have a large number of people. But Justin, the other piece that people need to realize and focus on is what has just happened. Potentially, we know there's a shortage of vaccine. The governor has said it. Everyone has said it. When we added the 65 and over category, we added up to 7 million people eligible. We don't have the vaccine for that. So let's say there's another 2 million people eligible as taxi cab drivers and restaurant workers. We don't have a vaccine for that. We are adding to the number of people who are eligible when we don't have the vaccine. And trust me, as you know, and people that are out there listening, very, very frustrated how to get a vaccine. Some people telling me they have to drive as far as Rochester and Syracuse to get a vaccine from the state-run facility because our county is very, very controlled as to who we can vaccinate through the county health department. So the micromanaging from the governor's office is it's happened a lot, and it's very challenging for us. But at the same time, you're adding more people to the eligible list when we don't have a vaccine. That is not the proper way to manage it.
Yeah, and that was actually my next question, is the frustrations from people who are eligible right now, like those 65 and older who maybe do have a comorbidity where if they had COVID-19 complications would be worse. How do you want to see the process managed? Because it does seem like now there still is so much confusion as to how many vaccines are we going to get? What is that going to look like? How many slots will I have open for appointments? And people are just confused and frustrated.
Very much so, Justin. Way back at the beginning of this vaccination process, the governor kept saying, and everyone from their office, schedule out as far as you can, and we heard people were scheduled out as far as April. We took the position here with my team, we will not set up the slots until we have vaccine. Erie County, Cattaraugus County, multiple counties receiving strong criticism that they had to cancel vaccination clinics. We knew that was going to happen. That's why we didn't do that. We did not schedule vaccine when we didn't have it. Now the governor has changed scope, which is understandable that method wasn't working. Now we're not going to schedule people several weeks out. Only schedule when you have vaccine. What my belief is, and many feel this throughout New York State, let this go to the professionals, and that is our local health department. They have plans that have been developed for years. This is their Super Bowl. They are waiting to show everybody their method, how they can do this quickly and effectively. We had 700 people or more vaccinated at JCC last week, and we have not stopped getting compliments. The coordination with Daniel DeMart and his staff at JCC, Barry Swanson, everyone at the athletic complex, George Sisson, worked out great. The governor's office loves this site. JCC is phenomenal. They're saying, we are going to push. The problem is we don't have vaccines. If we are allowed to have a vaccination site at JCC, I guarantee you we can get 700 or more people through that a day. But the governor has to give the opportunity to those who do it the best. That is our local health departments. I've said it at the beginning. I will continue to say that. The hospitals have had concerns that they're capable, but it's not their wheelhouse. Put this in the hands of those who can do it. H1N1, they proved themselves. They can do it again. I know they can. And that's local health departments throughout. Not to mention the Chautauqua Center, our doctors, our local physicians, everyone. But once this vaccine comes, with all respect, the governor needs to step back, let the professionals do their job. And I guarantee you, we will get our residents vaccinated quickly and efficiently.